So thread lifting, one of the hottest new procedures. So what is it?
So basically, you can use the threads anywhere, top to bottom. On the face, use it to lift the eyebrows, around the cheeks to redefine and lift the skin. A lot of us were not happy with the little marionette lines, and of course, the neck. It restores the jawline, and it lifts and tightens the skin because it stimulates the collagen.
Okay.
And basically, not kind of to be taken away. About 10 years ago, we had the non-resorbable threads, and lots of problems with them. Now, with the new threads, the material they're made has been used for years by the surgeons to sew the muscles back together, has been used in cardiac surgeries. So with the new threads, what they do around the face, they go under the skin and they lift the skin. What they have, they're little prongs that support, and they get hooked into the tissue under the skin. And so you can lift the eyebrows. As we age, kind of the eyebrows go down. You can lift them, give a more awake, rested look. You can lift around the cheekbones. You can lift around the jawline. Also, what is like really, really nice, around the lips, because a lot of patients don't want the fillers, or they don't need the fillers around their lips, and you can use the threads to redefine the lips.
And kind of pick it up a little bit.
Pick it up, roll it up, shows the Cupid's bow a lot better. Also the little barcode lines above the upper lip, it also helps to stimulate the collagen and to smooth out the area. It's also nice because once they get resorbed, there's a lot of collagen left behind. So the skin tightens up. The skin gets more youthful than what you start with.
Now, nasolabial folds. And we had a discussion about this in our green room. That you say you hardly ever use filler on the nasolabial folds anymore. And I'm paraphrasing you slightly. You're able to take the threads, I guess they go inside, and what, you tack, like, give a lift and you tack up, is it the muscles, the skin, and it lasts for about 9 months? I mean, how does it work?
So, yes, I don't kind of use much fillers in the nasolabial folds because the threads, they help to lift kind of the weight part of the skin from the front, and they tackle the skin, they tighten the skin, and it restores a really nice shape to the face. Also, when we lose volume in the face, it kind of gives a little bit tired look. So by lifting with the threads, it gives a very, and that's the goal. You want to look rested, you want to look youthful, you just came back from a vacation, and now everybody making comments on how good you look.
So the little jowl, okay, let's say jowl, like marionette lines, is that these lines right here that come down?
Yeah.
So you actually go in and you could tack it up a little bit. Is that kind of how it works?
So basically, along the jaw, there's one little poke. So also, the nice part, it's really no downtime, kind of social downtime. So one of the pokes, kind of the thread comes along the jaw, and it pulls kind of this whole area, and it lifts, and pretty much like when I do threads along the jaw, almost never I have to use fillers in the merit. Because when we have all the volume loss and all the skin kind of falls forward, adding more volume in the front, it just makes the face look long.
So, because we were talking also about like too much fillers in the face will give you a heavy face. Makes your face droop a little bit. This doesn't do that.
No. And also it lifts, it gives that youthful look where it's a youthful face, it's thin in the front when you look at the patient, anybody. And they have more volume, they project more from the outside, and also the mid-face. So you want to restore the volume on the outside and kind of keep a nice slender look, because you don't want, a lot of patients when they have too much filler in the front, the face looks heavy. It almost looks like worse than what they started with. They have like tennis balls in the front, it doesn't have a really nice proportion. So it's good to kind of restore the volume and kind of pull the skin
And it lasts for
back.
about 9 months?
It lasts longer than 9 months. The threads resorb about 6 to 9 months, and then the collagen that is left behind, that makes it last longer.
Okay, let's say a woman in her 40s, she doesn't like the way she's aging. Maybe she has big nasolabial folds, some jowling, marionette lines. She just looks a little tired. Could she go in on a Wednesday, get the threads? I mean, if everything works out, on a Wednesday, and then she's at a party on Friday in the desert?
Absolutely.
So there's not, I mean, really the downtime, you could be at a party in
She
3
can go to a
days?
party that evening because
And will already
it's a
look younger?
blunt, yes. So you have the immediate result. And she'll look younger that day. And I actually do half of the face, and then I show them before I do the other half.
Oh, really?
And you can totally see the difference. And they do it. They're a little bit sore after that, but kind of anybody looking at them, they wouldn't be able to say that they had anything done because there
Men
is
and
no
women are
blame.
getting these thread lifts?
Lots.
Do I need a
have a-
thread lift in your opinion, your professional opinion?
As we said, anybody over 40.
Okay,
should.
okay.
Again, so we're starting
But you don't get a
aging.
pulled tight look.
Not at all.
No, okay.
It's like, it's so different than a facelift. It's like when you do a facelift, you have the pulled tight look. With this, you just kind of, when you have to make the little Christmas baskets with the saran wrap
Yeah.
over, and then you put the blow dryer to shrink the wrap around the basket, that's pretty much kind of what you get with the threads.
So you love it?
I love them. Threads and the fillers.